So
Yeah.
welcome all my friends, and thank you for taking out time to attend this function. It's a short function, it's a small function for about half an hour or so. So out of that, about 7 minutes is the film which I wish to release. Um, I mean, many of you are doctors and from medical background, but if there are any who are not from ENT background, medical background, let me start with some basic stuff on a newborn hearing screening. So nobody in this world, nobody is born dumb. So a baby can be born deaf, and because speech develops by feedback, um, if they're not hearing, they don't develop the speech. And the golden period is the first 3-4 years of the time, you know. Now, um, in some time ago, we didn't have an objective way to measure the hearing, and hence it was difficult. But now there are plenty of ways we can measure the hearing even in the newborn child. Um, in England, where I live, the program is very well established, and thanks to Gwen Carr, you know, who had started the program, who is on this meeting right now. Uh, so on the day the baby is born, the hearing is tested. Uh, and if somebody is deaf or has hearing impairment, then we can give some sort of amplification depending on how much and what kind of deafness is there, possibly a hearing aid or possibly cochlear implant, whatever is needed. Once they start hearing, they start speaking. So the disability just reduces dramatically. I'm not talking in this event on the deafness in adults, um, uh, uh, but what we used to do as in Ideal Charity, we have been doing a lot of camps in India and at other various places. Um, During those camps, we used to see children who were 4 or 5 years old, for example, and we gave hearing aids to them. But the problem came when uh, those children, after receiving the hearing aids, start hearing those sounds, but they were not able to relate them. So the speech therapy was lacking, and some of them were living in villages and other places. So at the end of the day, they could not utilize the full function of that hearing aid. Then we thought that if we focus our effort on newborn hearing, then, and if they start hearing from very beginning, then we don't have to actually depend on the speech therapy and all that. Um, so this is just an effort to start a program. I mean, there's various programs going around in India right now, but everything's so fragmented. And following this meeting, I'm trying to bring all the states and union territories together. I've already written to all the principal health secretaries, and some of them might be able to join the call as well, and also the director of the National Health Missions. I'm in touch with them directly, and following this, we will try to find ways and means to see how we can take this program forward along with the government and with the third sector. I can see that Shantanu Moira, she is a well-known Bollywood composer. He's also joined, and he will be talking to us later on. Now, without much delay, what I'll do is I will play the film. The film is in Hindi language, but there are subtitles in that. And the film shows a boy who never got a hearing aid, became deaf and dumb, and what happens. And then we go back and see if we had given the hearing aid to this child and the child would have developed the speech, then what would have been the scenario. Follows by a message from the Union Health Minister of India, Dr. Harshvardhan. He's also the president of the executive body right now with the World Health Organization. There's a message from Dr. Balram Bhargav. He is the chairman of the Indian Council of Medical Research. So it's a 7 minutes film. So let me play the film and you enjoy that. Sorry.
ये सन्नाटों को विदा करके आवाज की दुनिया में कदम रखे। आइए देखें क्यों डॉक्टर नरवेश्वर सिन्हा ने इस शीर्षक को जन्म दिया। सुनोगे तो बोलोगे।
सुनते नहीं है जो उन्हें आवाज मिल सके, टूटे हुए परों को परवाज मिल सके। बच्चे सभी हैं, गरीब माँ बाप हो या अमीर, सबको जीने का ऐसा अंदाज मिल सके।
सुनोगे तो बोलेंगे।
Not able to see video. Sinha sir, we are not able to see video.
Sorry,
Video is not coming.
Sorry,
Yeah,
what
video
is-
is not coming.
Video is not coming.
Yeah, sir.
we can hear it, but not see it.
Yeah,
Oh, you
only
said-
disclaimer. The first one is seeing, no
Right.
video is seeing.
Okay, wait a minute. Let me stop sharing and then do it. I'm sorry about it. Sorry.
That's better.
Can you?
आइए सन्नाटों को विदा करके आवाज की दुनिया
Can you hear it now?
Yes, yes.
Yes, thank
Yes,
you.
yes.
में कदम
You
रखे।
can see also.
आइए देखें क्यों डॉक्टर नरवेश्वर सिन्हा ने इस शीर्षक को जन्म दिया। सुनोगे तो बोलोगे।
सुनते नहीं है जो उन्हें आवाज मिल सके, टूटे हुए परों को परवाज मिल सके। बच्चे सभी हैं, गरीब माँ बाप हो या अमीर, सबको जीने का ऐसा अंदाज मिल सके।
सुनोगे तो बोलेंगे। वीडियो देखाচ্ছে।
साहिल के माँ बाप ने अगर उसका बचपन में इलाज कराया होता तो वो सुन और बोल पाता और ये कहानी कुछ इस तरह होती। साहिल!
कुछ नहीं होगा पापा, कुछ नहीं होगा। हेलो हेलो, एम्बुलेंस, जल्दी आओ।
भारत के स्वास्थ्य मंत्री के रूप में और एक नाक कान गले के विशेषज्ञ के रूप में अपने सभी भारत के माँ बापों से मैं अपील करना चाहता हूँ, आपके परिवार में जब भी नए बच्चे का जन्म हो तो प्राथमिकता से इस बात की जांच अवश्य करें और इस जांच को अगर आप नहीं कर पा रहे हैं तो विशेषज्ञ की सहायता से जरूर करें कि आपका बच्चा ठीक प्रकार से सुनता है अथवा नहीं। अगर वो ठीक प्रकार से नहीं सुनता है तो शायद वो अपनी स्पीच भी नहीं विकसित कर पाएगा। अगर वो नहीं सुनेगा तो वो बोल भी नहीं पाएगा, और अगर वो 3-4 साल तक नहीं बोल पाया तो शायद जीवन में कभी दोबारा वो अपनी स्पीच को विकसित ना कर पाए। इसलिए मेरी अपील है कि इस बात की गंभीरता को आप समझें। भारत सरकार ने ये सुनिश्चित किया है कि बच्चे के बहरेपन को दूर करने के लिए, चाहे कॉक्लियर इम्प्लांट जैसा महंगा ऑपरेशन हो या फिर दूसरी कोई भी जांच हो, ये सब सुविधाओं को भारत के गरीब लोगों को, उनके माँ बाप को, उनके बच्चों को उपलब्ध कराने के लिए हम कृत संकल्प हैं। इसे हम आंदोलन बनाना चाहते हैं। इस आंदोलन को सफल बनाने के लिए हम आपका सबका सहयोग चाहते हैं। याद रखिए, हमारे प्यारे बच्चे अगर सुन पाएंगे तभी वो बोल पाएंगे।
मेरा नाम डॉक्टर नरवेश्वर सिन्हा है। मैं मैनचेस्टर इंग्लैंड में रहता हूँ। आज मैं छोटे बच्चों की हियरिंग, उनकी सुनने की शक्ति के बारे में कुछ बात करना चाहूँगा। कोई बच्चा, कोई शिशु डम पैदा नहीं होता, यानी मूक पैदा नहीं होता है। जब वो पैदा होता है तो हो सकता है कि उसकी सुनने की शक्ति कम हो या ना हो, और क्योंकि वो सुन नहीं रहा है, आवाज अंदर नहीं जा रही, तो वो बोल भी नहीं पाता। तो धीमे धीमे बच्चा बधिरता से मूकता की तरफ चला जाता है, बच्चा डेफ एंड डम हो जाता है। इसलिए सबसे जरूरी बात यह है कि हम जितना जल्दी से जल्दी कोशिश करें कि हम बच्चे की डेफनेस को डायग्नोज कर लें और उसको ट्रीट कर दें। सबसे ज्यादा जो स्पीच है, आपकी वाक शक्ति है, जो डेवलप होती है, विकसित होती है, वो 3 या 4 साल तक की उम्र के अंदर होती है। अगर हमने ये गोल्डन पीरियड मिस कर दिया तो बच्चे की स्पीच नहीं आएगी या बहुत कम आएगी। इसलिए अगर आपको थोड़ा सा भी भ्रम है कि मेरे बच्चे को सुनने में कुछ तकलीफ है, तो आप सीधे सीधे डॉक्टर के पास जाएं, उनसे बात करें। और अगर डॉक्टर ये कहते हैं कि आपके बच्चे को सुनने की मशीन लगेगी या कुछ और इलाज चाहिए, तो वो करवा लें उसको। उससे क्या होगा, तो उसकी स्पीच डेवलप होगी, विकसित होगी, और बच्चा सहजता से बोलने लगेगा और सुनने लगेगा।
आईसीएमआर सपोर्ट कर रहा है इसको, WHO के साथ भी काम कर रहा है कि और असिस्टिव टेक्नोलॉजीज के लिए हम लोग बहुत आगे बढ़ रहे हैं। उसमें जो ये सुनोगे तभी बोलोगे, क्योंकि एनीवन हु इज डेफ विल रिमेन डम अनलेस हिज डेफनेस इज डायग्नोस्ड अर्ली। तो ये इनिशिएटिव बहुत एसेंशियल है, और मैं चाहूँगा कि बहुत बधाई दूंगा कि इस इनिशिएटिव को आप लोग बढ़ाएं और पूरे देश में फैलाएं, जिसमें लोगों को मालूम पड़े। इसके लिए कई टेक्नोलॉजीज भी डेवलप करी गई हैं कि डेफनेस को पहले कैसे डायग्नोज कर लिया जाए। उसमें कुछ इंडिजिनस टेक्नोलॉजीज भी हैं, कुछ लो कॉस्ट टेक्नोलॉजीज भी हैं। वो हेल्थ टेक्नोलॉजी, उनका असेसमेंट भी हो गया है आईसीएमआर के थ्रू, और वो धीरे धीरे मिनिस्ट्री ऑफ हेल्थ से प्रोग्राम में भी आ जाएंगी। और इससे मैं चाहूँगा कि डेफनेस जल्दी डायग्नोज हो जाए, जिससे बच्चा बोल सके।
सुनोगे तो बोलोगे एक ऐसा प्रयास है जिससे हम भारत के बच्चों में चाहते हैं कि जब वो सुनेंगे तब वो अच्छे से बोल पाएंगे और अच्छे से सीख पाएंगे।
एक न्यूरोलॉजिस्ट की हैसियत से जब हम बच्चे को देखते हैं, वो हमारे पास तब आता है जब उसको बोलना नहीं चालू होता है, और उस समय जब एग्जामिनेशन करते हैं तो पता चलता है कि उनको सुनने की तकलीफ है, और वो सुनने की तकलीफ की वजह से उनका बोलने का डेवलपमेंट नहीं हुआ है। और जब बच्चे 7, 8, 10 साल की उम्र में हमारे पास आते हैं तो उस समय उनका इलाज थोड़ा मुश्किल होता है। तो मैं उन पेरेंट्स से अपील करना चाहता हूँ कि जब भी बच्चा पैदा हो उसकी हियरिंग चेक करवाइए, ताकि आपके बच्चे को, आपको मालूम रहे कि आपके बच्चे को स्पीच डेवलप होगी कि नहीं होगी। और यही एक कार्यक्रम सुनोगे तो बोलोगे के अंतर्गत अवेयरनेस जो है क्रिएट करना चाहते हैं।
Right. Thank you so much. I hope you enjoyed the film. Today is 3rd of March, and it is the World Hearing Day. And to release this film on that occasion, I think is the best time to release such a film, and also an attempt to disseminate this phrase, Sunoge to Bologe. Now, I'll request some of the participants to speak few words about this program. And the first one will be Gwen Carr from Manchester. She is a lady who actually was involved in starting the newborn hearing screening program in England, which is a very successful program. Gwen, it's all over to you.
Thank you. And first of all, thank you for inviting me to this. It's a real privilege, particularly today, on with a fantastic report that's come out from WHO, and that your film to go with it, Dr. Sinha. I think it's a real privilege, and I'm very conscious that I'm now speaking after a number of very esteemed experts have just appeared on that film. So I offer my contribution humbly. I am a former national lead for antenatal and newborn screening in England. And really, in my heart and background, I'm a teacher of the deaf and an educational audiologist who became involved in screening because my whole professional life was around seeing children who, as pointed out in the film, came too late really to have their best outcomes in life because they were late diagnosed. So, and I had the privilege of leading one of the first sites in England, in Greater Manchester. And I know, and I'm from Bolton really, so I'm very pleased to see an expert on from Bolton, in the rollout of the first wave of newborn hearing screening in England. And after that, I joined the national team. In England, it came about, as it's clearly going to come about in India, through passion and commitment from doctors, from researchers, and importantly also from parents, who are the ones who know what early intervention and early identification and the difference that can make for their children. But I have to credit Professor Adrian Davies, who was my boss, who, for the vision in the UK context. I was the humbler implementer of the vision in many ways, but it was his leadership that allowed this to happen. And when we started in 2001, the average age of identification of a deaf child in England, where you may think that some of our services were very well mature and established, was between 2.5 and 4 years of age. Within 12 months of the implementation in England, the average age of fitting a hearing aid had come down to 9 weeks of age. And that was with passion and drive, some evidence from the Colorado program actually proven to us that this could be cost effective. But it was a huge, really, implementation of passion, together with the technology that was spoken about. And importantly, and this is the thing I feel we learned more than anything else, importantly, the building of a system. Because the screening is just the first step. And, you know, I'm looking at my colleague Vicky on the screen, on the screen I have in front of me, who really has been a good ally of mine in the England programme, opening up the next links from the screen, and we'll talk to the importance of the pathway. Because getting the hearing aid, getting the child screened, opens a door to the next stage, which is the diagnostics, which opens a door to the next stage, which is really support for families. So the amplification is crucial, but what is more crucial is, following that, is equipping the family to make the most of their child's opportunities, which screening has given. Because as we all know, that it's a human right. Language and communication is a human right. And every child has that human right, and every child in the UN Convention on Human Rights has the entitlement for the best possible health and the best possible education. And this is why the work Dr. Sinha is doing and other colleagues is so exciting, because it really does transform futures. But the child is born into the social context of the family, and we learn our language from the family, and parents need that support from each other as well as from professionals to change that opportunity into a reality. And on that note, I'm going to pass on to another esteemed colleague of mine. We started working together, having had a coffee together in Austria, probably 6 years ago, and it grew into the collaboration that we have today. So I'd really like to pass on to Snigdha, who is from, well, she'll tell you who she's from one of 2 very, very influential and successful initiatives and organizations. So thank you again for having me, and I'll pass on to Snigdha.
Thank you, Gwen. Snigdha has been working tirelessly. I see her in all the meetings I go to in Geneva at the World Health Organization, and she has introduced me to various other colleagues. She's a parent of a deaf child, and she's very motivated. She's the president of the Parent Association of Deaf Children who are lobbying this work. So Snigdha, over to you.
Thank you. Thank you, Dr. Sinha. Thank you, Gwen. It's a privilege and honor to be here. And Dr. Sinha, thank you for the beautiful film. I think it's going to really make a lot of difference, in our country. My name is Snigdha. I live in Kolkata, West Bengal. I am the parent of a deaf daughter, and I'm just very happy to share that I saw her photo and her experience story in the World Report on Hearing today, which was a great pleasure as a mother. So, and it is also an example that if early the identification and intervention can happen to a deaf child, even with profound congenital binaural loss of hearing, children can progress. So that's one side. And the other side is we have been trying to do this because being from a very grassroots level organization, we have also seen the other part of the story where children are not identified till a pretty late age. And also the parents don't know where to go, where to look for support. But I must say that today, after attending the launch of the World Report on Hearing ceremony, I felt very happy, I felt very reassured and confident that things are really going to change sooner than later in our country, in India. And I would also like to share here a little bit about the parents' collaboration, because I think this is the time when we really need collaboration alliance to the best possible extent. I'm part of a global coalition of parents of children who are deaf or hard of hearing, which we call GPOD, which is an international collaboration of parents groups dedicated to promoting improved systemic protocols and practices which encourage informed choice and the empowerment of families with a deaf or hard of hearing child throughout the world. So association with this GPOD forum has really enriched me, has motivated me more and more, that no matter if my daughter has grown up and is doing well, no matter if the children that come to our organization, they have a pathway in front of them, but we must keep on working for every child in our country. We must work as parents. We must be working side by side with professionals, adults with deafness, deaf and hard of hearing persons, and we must all work together to make the change really happen, across all the places. I just heard today in the webinar, in the award launch of Report to Hearing, that we have to, we can, and we must. These words were spoken by Dr. Shelly Chadda, and I really found them so motivating. And it's really that we have to, and we can, we have the capacity if we have the desire to do it. And we must, we really don't have an option. We cannot afford inaction at this stage of time with the numbers that we get to hear from the different reports published or shared by the WHO. And also, it's very important that we all work together. I'm so glad to see so many faces. I'm thankful that I know some of you from before, but also I see so many new faces, and it will be really, and privilege and opportunity to be in touch with this entire group, so we can really think of something something, meaningful, something with a long-lasting impact, and something that can really bring change in the lives of children. I think I'll end here. This is a very short program. So thank you very much. Thank you for the opportunity once again.
I think the microphone is off, Dr. Sinha.
Thank you so much, Snigdha. I know that you have to go for another meeting in US, and good luck for that. We move on to Shantanu Moira. Shantanu is a very well-known music composer in Bollywood. He has composed music for films like Three Idiots. Everybody must have seen that movie, Parnita and others. And he has agreed to come to this meeting and help with this initiative. And I'm so grateful to you. Thank you so much, Swati, for introducing me to Shantanu. And Shantanu, it's over to you.
First and foremost, I think I'm probably the only non-doctor out here, I think, which is daunting. Thank you, Dr. Swati, and thank you, Dr. Sinha, for calling me here. I'm a student of music. I'm a student of sound. And I think nothing gives me more joy when I hear this line, Sunoge to Bologe, because all my life, this is exactly what I've been working on. When we work on films, when we work on movies, we use sound to transcend nostalgia, to transcend imagination, to transcend flashbacks in people's lives. And imagine if that sound is not there. There's nothing to fall back on. There's nothing to go back to. And interestingly, not just the movies, I have been working with a lot of children from very disturbed areas, especially families which are affected by riots and war, natural disasters. And I know the role that sound plays. And Indians will understand this. If a child hears the sound of mandir ki ghanti, a temple bell, or a cycle bell, it evokes a happy nostalgia. It evokes a happy time. And that brings down the stress. These are things that we're dealing with every day. And imagine if a child is robbed of that power of imagination and falling back on something in life and it's a crisis just because it was not detected earlier in time. I think it's such a godsend thing that Dr. Sinha and so many of you are looking at this, because as I think Dr. Carr said this, that it should be a fundamental right to listen. I don't know in today's day and times if it should be a fundamental right to speak, but I definitely feel it should be a fundamental right to listen, because I think that is when it just creates the foundation for a prosperous human life in this planet, in this given time. Whatever I can do to be part of this program, I'm always there. And thank you for calling me here. And I just wish you all a lot of good wishes. We need to work on this together, because this is stellar. This is important, and this is a game changer. Thank you so much.
So much. I know you were recording earlier on, and I'm sorry to disturb you. But your few minutes were very valuable, and I'll be in touch with you to see.
Thank you so much.
What else you can do for these deaf children.
Thank you so much. Thank you.
We are running about 7 minutes late. So it's Martin Marshall. Professor Marshall is the chairman of the Royal College of General Practitioners in London. Very influential man in the health field. And I'll request Professor Martin Marshall to say a few words.
Narveshwar, thank you so much. It's a real pleasure and a real privilege to join this call today. And I'm so impressed with everything that you're initiating here. This is so exciting. It's a subject I feel particularly passionate about as a GP working in an inner city practice in East London, where we see a lot of preventable health problems, of which this is one. So just to remind those of you who don't know, general practitioners in the UK provide cradle to grave care first contact care, comprehensive care for families, for all kinds of conditions, acute illnesses, long-term conditions, prevention, and of course education. 90% of the contacts that people in the UK make with the health service are made in general practice, and we deal with 90% of those without having to refer on to specialist services. So for most people, general practice is at the heart of our health system. Newborn screening in the UK is one of the fundamentally important preventive programs that we run. We know 1 to 2 babies in every 1,000 are born with permanent hearing loss in either one or both ears. And screening, as has been described, is carried out early on, certainly within the first couple of months, ideally within a few days of birth, sometimes in hospital, sometimes in the community. It's an easy, very quick screening procedure, and an annual report is produced. The last one suggested that 99.9% of babies are screened every year in the UK, and that picks up about 2 or 3 babies in every 100 who don't show a clear response to the screening test. And those are the babies that are then referred on to formal testing through audiology services. And as a result of that process, the initial screening and then the formal referral and then the treatment, there's a massive number of children in the UK who are able to speak and able to socialise who would otherwise have been disabled for the whole of their lives. So it's a highly cost-effective and extremely important programme. It's a programme that we're proud of, and I'm just really delighted that there are moves to introduce a similar kind of program in India. So Narveshwar, good luck, and good luck to everybody involved, and thank you so much for this invitation. It's great to see you.
Thanks so much. Well, we'll need your support later on, you know, as time passes by. I'll be in touch with you and keep you updated. Thank you. Next, we move to Dr. Diego Santa-Hernandez. Santana is in Tenerife, Spain. The World Report of Hearing has come out today, and it was a pleasure to work with you. I was part of the World Hearing Forum who was supporting the World Report on Hearing, and I know that you were taking a lead. Over to you, Diego.
Thank you very much, Dr. Sinha, and thank you everyone. It's great to see so many already known faces, but what is even more exciting is to see so many new faces, people who I don't know and are really looking forward to continue collaborating with. Today is a great day, and some of you who've been here for a long time will realize how important this is, but maybe for others it not be so evident. We've been working with this for over a decade now, and my background is as an ENT surgeon, but when I became involved with working in low and middle income resource settings, I realized that I could be working all my life as an ENT surgeon and make no difference at the end of my professional life. So I actually retrained as a GP, as a general practitioner, because I realized that we had to change early detection, prompt intervention, and community action altogether. It's great to hear about the importance of the comprehensive programs, how education is so relevant, how family, the involvement of the civil society, of the parents, of the groups are actually, they cannot be the last people invited to these kind of meetings. They need to be at the very core of all the work that we do. And sometimes we as a specialist, we don't realize that because we have not been trained as such. And it's always very easy for me to talk to deaf people, to parents, to communities, even to politicians, but it is a lot harder to talk to my own colleagues, to ENT surgeons and to general practitioners, because we don't get this training and we need to learn a lot more from you. From an idea which was like thinking that for over 20 years we didn't have any World Health Assembly resolution related to ear and hearing care, we started mobilizing. It was a small group, just 5 people, started inquiring, what do we need to do to get a new resolution? And this took years to get the support from member states or WHO. But finally, in 2017, the World Health Assembly resolution 70.13 came up with 9 recommendations to the member states, to its own members, but also recommendations to WHO, including the World Hearing Forum that Dr. Sinha was referring to, and also this World Report on Hearing that we've launched today. So this is why it's taken a long time. And now the work starts. So the report is not an end product, it's a call to action that has been said. Like what we heard this morning from Shelley, and it was very nicely, remember, we have to, we can, and we must do things. Because when we talked about inclusion, everyone is ready to hear. When we talked about early ear and hearing care services, is very obvious. But when we talked about evidence and how to do things, we need to learn from each other. We need to produce more evidence-based data. And for that, we need everyone's collaboration. It was great to hear from this morning from the Honorable Dr. Vardhan from India on how in such a big country like India, it can be done. And I always say, if it can be done in India, it can be done anywhere because of the amazing challenges and the huge number of people living in the country. So that's a great example from all of us. So I simply want to just share what we're doing. Is we're all here in this together, and anything we can help with is our pleasure. And this, like the movie says, this could be the start of a beautiful relationship. So thank you, Dr. Sinha, for your call, and to all of you for your support. Thank you very much.
Thank you so much for speaking, Diego, and congratulations on the successful release of the World Hearing Report. I'll finally pass on to Swati Maheshwari. Dr. Maheshwari, she is a she runs her own media show. Is it Swati Show? Isn't it? What it's called? Swati. Yeah. So Swati has helped me in actually getting this film ready, and I'm so grateful to her. And she's always there whenever I call her or talk to her for all the support. Swati, over to you.
Thank you, Dr. Sinha. First of all, thank you for roping me into this such a noble initiative. And I remember almost a year back when I got a call from you and you mentioned that how relentlessly you've been trying to put an effort to, help people understand that early detection of deafness is so much important for a productive life of these children. And then he said that can't we do a small film, a short film, just 2-3 minutes film, which could actually, help parents understand the value of early detection, which could create a chain reaction, because that is what awareness is all about. It creates a chain reaction from one person to another. The message spreads, and that's how I jumped into the wagon and I said, yes, why not? And the kind of vibes that he has and the passion that he has for this entire purpose is really commendable. And thank you, Shantanu, for joining in and today, and the other good speakers that are there, Gwen Carr and the others. Thank you. What I really feel, and what was very important when Dr. Sinha was talking to me, is that this is one disease which is preventable. And when you're working towards, helping people out with preventable diseases, then I think every effort that we put in becomes very gratifying at the end of the day, because when you see results coming out of those things, when you see people salvaging out from such situations, then I think it's really, really very gratifying. And especially if you look at India, then we have 80% of the disease, which is deafness here in India, is avoidable, where we have 50% cases which are preventable, and the other 30% cases where we can give aids and different means of assistive technology to help them hear. So this is a huge problem in India, and in 1,000 children that are born in India, 1 children, I think, is not able to hear, and they don't get these opportunities of early detection so that we can identify them and give them the services of different cochlear implants and hearing aids and all that is there. So I think it is very, very important step that we are taking, that we are trying to create awareness about early detection, because that is the key to prevent deafness, especially if you're talking about country like India. And now with the regressive effect that the pandemic has had, and the kind of SDG goalposts that have shifted so much now, I think we need to move forward with more zeal, with more enthusiasm, so that we can save as many children as we can from this, because this has a lot of scholastic effect on their school days. It has a lot of effect on their productive life. And if we are able to save them early, then their speech development gets much, much better. So I think it's a very great initiative. I congratulate you, Dr. Sinha, for starting this, being the torchbearer, I would say, for this entire, this whole theme of creating early detection awareness amongst parents and amongst the society. So thank you, and thank you for having me also on this. All the best.
Well, thank you so much, Swati. Thank you for all your help. I mean, we have people who have joined in from all over the world. Sebastian is there. I can see him. Sebastian is in Uganda. Joanna Bircher had actually earlier joined in, but she had to leave. And through Joanna Bircher, I did help one of the schools in Uganda. And since then, I've been in touch with Sebastian. I can see Dr. Reddy, Mr. Reddy there. He's been traveling, I think, in the car, but he has been good support. There are so many of my friends in this group. I'm sorry, but I won't be able to say hello to all of you, but thank you very much for joining in. What we really next is to define ways as to how in each state and in each union territory separately, we can come out with some programs. I've been in touch with Ministry of Health, with the Joint Secretary Vishal Chauhan. I was talking to him yesterday, earlier on today, and we will come out with some sort of strategy whereby I know that the government network is not that effective right now, so we need to create a structure to go parallel with that so that the government can actually keep pushing that initiative. Till now, things have been very fragmented, staggered, and I'll try to bring them all together. I actually tried to create a forum, a WhatsApp forum of all the principal health secretaries, all these IAS officers from all the states and all the union territories. I also tried to include the directors of the national health missions in that, so that we think the same in the whole country, and we come out with some strategies which we will focus on. So this is just the beginning. Stay with me all the time. Do give me a phone call when you want to. I'll keep troubling you all. And thank you so much for coming and making this program a success. I just got a message from Patanjali Nair. He's the WHO lead on disability. And he said that he will see that he can get this film released in 11 countries, So that is, thank you so much, Patanjali, for that. I'm sure there's the English subtitles in that, and the same thing applies to any country, any developing country. And I'm so proud of that. And I'll share this with you, Diego. Please do use this. And thank you so much again. And have a good afternoon and good evening. Thank you so much.
Thank you, Sinha, for inviting us.
Thank you. Thank you. Super.
Bye-bye. Thank you. Bye-bye.
Thank you so much.
Bye-bye, everyone.
Bye.
Thank you.